Hello, it's me, Dr. Catherine Toomer, and family medicine, community health physician, and founder of Total Weight Care Institute, and also the creator of Total Wellness and Weight Care programs. Also, the creator of a profitable weight care practices. And so I help people lose weight, whether it is the weight in pounds, is weighing them down in life, or if it's the weight of burnout as a clinician or someone who doesn't have their own financial freedom or time autonomy. That's what I do. I help people get their lives back in professionally and also physically. So one of the things I talk about a lot about is health. Health is this ubiquitous thing that we all try to reach. And so many of us really don't know what it is. We think we know what it is, but we're never really told. And really, what health is when you are physically able to do the things that you want your body to do. And if you are psychologically in a place where you are comfortable and you feel good, and if you're socially in a sound place where you're safe and you're supported. And so health is really different for every person. There is no one place. Getting healthy and being healthy, again, isn't a place, it's a journey. Um, Getting healthy is what we do to try to obtain health, which is different. Again, is different for everyone. So there is no one size fits all. And so really, health is the striving to get healthy. So as we say, the journey is the destination. There is no pie in the sky place where suddenly everything works perfectly and suddenly nothing is a problem and we just get along with everyone. It is us striving to do better at all times. Hi, Chris. And um, Oh, I'm just getting a message from someone who usually comes in every week, and I appreciate it so much. And so just letting me know they won't be able to watch today. Hello, Aunt Cynthia. Thank you for coming. So when we talk about health, what it is really is just striving to get to a place where you are feeling good, physically, psychologically, and socially. It is not the absence of health only or the absence of disease. When we feel a certain way, we just don't want to feel bad. But feeling good doesn't mean you're healthy. It just means that you're on your way to being healthy. I know this sounds really like I'm talking in circles. So really, when it boils down to, there's really just four things. I call it the 4 M's. And if you want to strive to be healthy or you want to maximize your health, there are really just four things you can focus on so that you don't have to do a whole bunch of other extraneous things that really won't help. Or you don't have to follow the latest trend. You don't have to watch YouTube and watch TikTok and see what everyone else is doing and try to do what they're doing, because for every person is different. So really, there are four things, really. And number one, the 4 M's: movement. Second M, mindfulness. Third M, muscle. And the fourth M is medication if you need it. If for number one, for movement, the movement could be any kind of movement that you're able to do that doesn't in some way injure you or cause you pain. And so a lot of time when they say no pain, no gain, up to a certain point, yes, there's going to be some soreness, but there should not be a lot of pain when you're doing any type of movement. And if you do have pain, you need to find out why. Always ask why. Is there something underlying that needs to be taken care of that is making it difficult for you to do certain things? Now, movement, there is no one type of movement that's healthy. You can dance, you can walk, you can play with children. Laughing is a type of breathing that is movement. It's moving air in and out of your lungs in a way that helps your cortisol levels come down. Those are all movements, and those are all things that you can do to be healthier. Mindfulness is probably one of the most overlooked areas of health. It is what makes us psychologically healthy. It allows us to cope with issues that come at us in the world. When we feel overwhelmed, when we feel stress, it is simply because situations are overwhelming what we think are our coping mechanisms. And so there's a couple of ways of increasing mindfulness. You can get rid of the stressor, you can manage the stressor, or you can manage your reaction to the stress. And it's managing this reaction to the stress that we have the most control over. And so that is where mindfulness comes in. Gratitude journaling helps, just like if whatever you focus on, that's what grows. So when you focus on gratitude, things that you can document later as, for your day, you'll start looking for those things as the day goes on. Oh, that's one thing I can write down in my gratitude journal later. There's another thing I can write down in my gratitude journal later. Instead of looking for problems, you're looking for things that you can be grateful for. That's a kind of mindfulness. Meditation's another type of mindfulness. Imagination, imagining situations, imagining yourself in a better situation, in a better place, is a form of mindfulness. And so whatever it takes to help cope with situations within your life, that leads to health, and that is being healthy. Muscle is by far one of the most important organs of our body when it comes to health. Of course, our heart, you want your heart to be healthy, and you want your brain to be healthy, and kidneys and liver and all the rest. However, with the one we have the most immediate control over, other than our minds, which is mindfulness, is our muscle. You can build your muscle right now, every day, and it immediately starts bettering your health, your well-being, your sense of well-being, your strength. When you feel strong, you feel better. But it helps you. It also, when you build muscle, it helps determine where your health will be later. It helps with your strength. It helps kind of protect you from illness. It protects you when you have illness. It protects you from falling, which becomes a major issue when you're older. And muscle gives off lots of different chemicals and molecules that help other things work better in your body, I guess is the best way of putting it. Won't get into a lot of details, but they're called cytokines. So when they're given off and your muscles kind of activated, there's a lot of different positive feedback mechanisms that occur. And then the fourth was medication. Often we avoid medication and we'll say, I'm going to change my lifestyle in order to avoid medication. And in some cases that works really well. However, often what that means is you're pushing a boulder up a hill until the ultimate goal is to get yourself to a certain set point so that you can then move on from there. When your body needs to reset and it's fighting against a disease process that's not being treated, it just makes your work so much harder to reset your body. It makes your body work so much harder in order to get back to where it wants to be. If your lungs aren't functioning like you want them to, then your heart is going to be strained. If your heart's not working like it should be, your lungs and the rest of your body and your circulation is going to be strained. If your blood pressure isn't what it should be, it's causing damage every single day that it's high. Your blood sugars cause damage every single time they go up. Taking medication helps prevent any more damage while you can then change your behaviors, if you want, change your lifestyle in order then to take over. And once you're able to then take over, then you start cutting back on the medication, but protect yourself first and immediately before, because the truth is, many of us, our intentions are good, but if we were able to reverse a disease, we should have been able to prevent it also. And if we weren't able to prevent it, at least use whatever tools are at your disposal to then get to a point where you can better keep yourself there. And that's essentially what medication does. And so those are all my little tools that I use in order to measure health and be healthy and realize that health is ongoing. It never stops. It's the journey, not the destination. And it's not exciting often. It's not something that you have to focus on every single second of every single day, which is why I tend to veer away from, focusing on weight, even though I do focus a lot on weight, obviously, but weight health and weight care, because weight loss, again, if the focus becomes that, it often pulls you away from your health, because in a lot of ways, focusing on weight is psychologically unhealthy, and it leads to if it becomes obsessive, it can become medically unhealthy because certain behaviors get adopted, and then socially it can be unhealthy if it interferes with relationships of those people around you. And so health is really, really so much more important. Being healthy, striving to be healthy is so much more important. So again, I'm Dr. Catherine Toomer. I know I talked a lot today. And if you have questions, you can always put them in the comments, and then I will answer them as best I can. If you are someone who is looking for ways to get healthy, you're not really sure how, I am the founder also of Health, Wellness, and Weight Loss Centers. But health and wellness are really finding the causes of what removes people from health and trying to bring them back to health is really what I do best and what I love to do. I'm a natural problem solver. I love puzzles. And so, if you have questions, of course, I'm more than happy to help. If you are a clinician who's looking to try to create, create comprehensive and compassionate wellness and weight care in a practice, as well as a profitable practice, because it's okay to earn and serve at the same time. And so I do have a method where I have grown my business. And so I'm now sharing that with other people because I realize it's so important to provide places where our patients and other patients and people who are seeking have a soft place to land. And so that's what I'm helping to create, those places. So, you can find me at my website, drtoomer.com. You can contact me there, or you can find me pretty much on any social media platform as Dr. Toomer, except for TikTok, where I'm Dr. Toomer Talks, because there was already another Dr. Toomer and I had to figure out something else to do. And since I like talking, well, here I am. So again, I'm Catherine Toomer, Dr. Catherine Toomer, family medicine, community health physician and founder of Total Weight Care Institute. And I appreciate you being here tonight. And I'll see you next Tuesday at 7 o'clock for Dr. Toomer Talks. Good night.